Hello, welcome to another exciting episode at Beyond Bold podcast. My name is Oyede, and with me.
It's hard you still have the humble guy, the guy with two names. Let me not do too much.
The
The guy with
guy
like
with
two names,
only
two
two names.
English names
Only him.
actually. It's still me, David Richard, with you.
And today we are at Pear Family Center and Special Needs. And with us today is Dr.
Ada Solomon is my name.
Okay, he's actually a cosmetic surgeon, guys. We're here to get exciting details about cosmetic surgery. So hold
He's
on.
cosmetic surgeon. He's also a family.
And a family
Physician.
family physician, yes, you guys. So sit back, relax for exciting, juicy conversation with the doc with the most. All right.
Welcome, Doc.
Thank you. You're welcome.
Welcome, sir.
Yeah.
Actually, first of all, let me just let's be a little bit free.
Yeah, that's right.
How's business been?
Well, it's been good. It's been good.
Uh,
Yeah.
and how are you
It's been very
coping with the situation of the country and with family? And man, we have a lot of responsibilities on our hands.
That's right. That's right. We always find our way around it all.
Yeah.
Because that's the only way to stay on top. All right.
True.
Yeah, you have to find your way around it.
Yeah. So, doctor, we would love to talk to you about cosmetics today. And one thing I personally we would love to know. Let me say we would love to know. Especially, I'm sure she will.
I'm very interested. See this one. I'm very
Actually,
interested.
we want to talk about liposuction.
Oh,
Yeah, liposuction surgery. We want to know benefits. We want to know the aim. We want to know the type of liposuction. We want to know if men do liposuction. We want to also know if it's safe, if it's unsafe, the healing process, the process of it.
Let's just
if
take
there
it
are
one at a
checkups,
time. No, let's take it one. One at a time.
I'm just like- I'm
So
just
it
like-
doesn't
I'm
get
trying
so
to bring-
overwhelmed.
Yeah, I'm trying to
It doesn't
bring
get so
everything.
overwhelmed,
I'm just trying to bring everything out of my head so I can.
I
Okay,
know, right?
Yeah.
okay.
Now
That's
I'm
all
calm.
right. That's
I'm
all
calm.
right.
I'm calm.
I think let's just start with what is liposuction. I mean, we've been hearing lipo this,
Yeah.
lipo that. What is liposuction?
Okay. Thank you for that. Let's start from what cosmetic surgery is.
Yeah.
We would like to simplify it so that maybe our listeners can actually understand
Yeah.
what we're talking about. When we talk about cosmetic surgery, see, this is a situation whereby somebody that is healthy chooses to have an operation
Okay.
or an invasive medical procedure to just improve their appearance for cosmetic reasons, not medical.
Oh.
Okay? So the person is healthy, just feel like I'm not looking my best. Let me just do something to improve my appearance. That's what we call cosmetic surgery. Bear in mind there are other cosmetic procedures that are not surgery,
Yeah.
right? Like Botox or when we do all those dermal fillers, right? Those ones don't involve surgery, right? Okay, now we go to liposuction. So liposuction is actually one of the techniques in cosmetic surgery
Okay.
that we use to remove excess fat
Oh.
from under the skin
Yes.
by suction.
Okay.
Okay, so that is what liposuction is all about.
Oh.
By suction, like
Yes, we use suction.
they suck out the fat from
Yes,
the
we
body,
use negative pressure to suck out the fat
and then they
from
put it
under.
somewhere else.
Yes, we can. That's when
In
we talk
most
about
cases.
fat transfer.
Okay.
Oh.
Yes, that one.
Okay, the fat is being removed from.
Yes,
one
you
part
can
of the
remove
body.
fat from one part of the body by liposuction, and then you treat the fat, and then you transfer it to another part of the body, which is fat transfer.
Oh, really?
Yes.
Okay, so when the fats are being removed, they're actually being treated.
Yes.
Before
Yes, that's right. Yes.
Okay.
Because
Okay.
don't forget that fat is a living tissue.
Yeah.
You understand?
So even when it's removed?
yes, even when it's removed, it's still alive.
Oh, really?
So before you transfer it to another part of the body, you need to provide it with some necessary nutrients that will enable it to establish, to be able to live in the new environment you are taking it to. So that is the treatment. We need to do that first.
How safe is this transfer?
Well, cosmetic surgery is actually very safe, especially when we talk about liposuction. Remember, like when we do liposuction, we don't even put the patient to sleep. The patient is awake all through.
There's a procedure for it.
Wow.
There's a name for it. I think they call it local.
Yes, we call it local anesthesia,
Yeah,
but in
local
this case, we
anesthesia.
actually have a particular local anesthesia that
Don't
we
worry,
use.
I've done my
We
research.
call it
I,
tumescent fluid. We use tumescent anesthesia.
Okay.
Yes, this is a new technique. What we do is that we put numbing medications inside some fluid, and then we just infiltrate the area we want to work on. So that
Okay.
area goes numb. Yes, the area goes numb.
Throughout the process.
Yes, throughout the process. For instance, if we just want to work on the abdomen, we just numb the abdomen. So the
Okay.
patient is awake, the patient is communicating with us throughout the whole procedure.
and you say you would think, or rather, you would just be very frank.
Yeah,
Doctor,
okay.
patient.
All right.
How safe? Like how safe is this procedure? How safe is it?
Well, let me put it this way. Liposuction especially, I can tell is almost 100% safe. Yes, almost 100% safe. Because one of the major complications we used to have in cosmetic surgery is actually the fact that before this time, we used to put patients on general anesthesia.
Okay.
And general anesthesia comes with a lot of complications.
Yeah.
But now that we use local anesthesia using the tumescent technology,
You
we
what?
discovered tumescent, that is the infiltration that we do, that we just numb the local
particular
place,
area.
particular area we want to work on.
Okay.
So the patient doesn't go into, any kind of general anesthesia.
Okay.
And then, the patient is talking with you, the surgeon. So if before anything goes wrong, you will know.
Yeah.
So liposuction is extremely very safe. But I'm not saying that maybe it doesn't come with any complication at all. We want us to talk about the complication right now.
Yeah, we'll actually dive into
We'll
that.
talk about that actually.
At some point.
At some point, we'll
talk about that.
it. Yes.
Is there like an aim? Should I say? Is there like an aim to liposuction when it comes to the person who wants to do liposuction? Is there like an aim to it?
Yes, definitely. People come because they feel that, okay, maybe they are not looking their best. For instance, maybe women do cosmetic surgery more than men.
True.
And one of the commonest procedure we do in cosmetics is actually that liposuction. Like in America, for instance, that is the highest. That's the one that most of the patients do, liposuction and maybe fat transfer. Okay. Now, for instance, maybe women, they are so concerned about their physical appearance. Sometimes they'll tell you, Doc, I'm not happy with the way my tummy is looking. So I want you to remove some fat. So what we'll do is we'll remove the fat, and then the tummy becomes flat again. So some people will come and they'll tell you, well, my thigh is big. I want you to remove some fat from there. So we do that. So most of them comes because they are not comfortable with their physical appearance.
So, I actually have a question.
Yeah.
So when you remove the fat from this part of the body, let's assume the stomach,
Okay.
is there a possibility that the fat will grow? I don't know the term,
Yes.
medical term. Like,
Yes.
is it possible if I don't do exercises or eat right? Is it possible that I might grow the fat again?
Like when we do liposuction, we also actually educate the patient. Because if you just do liposuction and you still go ahead and continue with your previous lifestyle, the fat may come back. Because one thing about fat is that, you see, when you eat and if your input is more than your output, then the rest is stored as fat. Okay, definitely you have to maintain a healthy lifestyle.
Yeah.
If you don't maintain a healthy lifestyle after the liposuction, of course, the fat is going to return.
Mm-hmm.
So that's why we don't just do the liposuction and send the patient away. We actually educate them on the kind of lifestyle they need to live so that the fat does not return.
So are there like side effects to liposuction? Because some people might go and have it, and out of haste, they might not have it done well.
Yeah.
There are some that would do it but not done well. Let me just use that term, not done well. So are there like side effects for this process?
Procedure. Yeah. Okay, let me put it this way. there is nothing in life that doesn't have side effects.
Yeah,
Yeah, honestly. Even
everything
the
that has
food
an
we eat,
advantage has a
yes, even the food
disadvantage.
we eat, it has its
Yeah.
own side effect. You know, actually, it's even the side effect of overeating that is giving us this
This
opportunity to talk
opportunity.
about
Yeah.
liposuction and the rest. So actually, it comes with its own side effect.
Okay.
But for the fact that the individual undertaking this procedure is not actually sick, so we actually take our time to make sure that we prepare the patient well, because cosmetic surgery is not always an emergency. So you have enough time to prepare the patient to minimize the side effect. Okay, but some of the side effects that will come across is something we call blood accumulation under the skin.
Oh, wow.
Because, for instance, when we remove the fat, there's actually an empty space that is left there. Okay, sometimes blood will start accumulating there, which we call hematoma. This is one of the side effects, and that is the reason why after the operation, after the procedure, we give patients this band, tight band,
Okay.
Like a
yes,
waistband.
waistband and all that to apply, so that that gap that is supposed to be there will be closed.
We compress.
Yes, until healing takes place.
Okay.
Then the other thing also that we also experience is that sometimes you discover that maybe the area where we worked on becomes numb for a while,
Okay.
but usually the sensation returns back
Over time.
over time. Okay. Then one other thing also is that sometimes when we over remove fat from a particular part of the body, the skin color in that area will change.
Okay.
So that's one of the but that also will return with time. And then sometimes, I talked about the tumescent fluid that will infiltrate to numb the area. Sometimes if the surgeon fail to calculate the actual volume that is required, some of the fluids can actually accumulate in the lungs, which we refer to as pulmonary edema.
Oh, wow.
But this goes also with time. Okay?
Okay.
Then sometimes, although very rarely, because very rarely some patients come down with maybe infection of the site of the injury of the surgery. Yeah, because it's an invasive surgery. Sometimes the site gets infected.
Yeah.
That is why routinely after the operation, we actually put patients on antibiotic. So most times, all these complications, we already have them in our minds. So we make arrangement for the complications so that it doesn't even come up at all. That's why I explained to you the other when we started that it's actually very safe. We take our time to make sure that this complication doesn't come up at all.
Okay. And are they like types of
Liposuction. Yes. There are various types of liposuction, and we actually name them according to the section of the body that we want to lipo. For instance, when we're working on the abdomen, we call it abdominal liposuction. We can actually work on the thigh, which we lipo the thigh. Okay, some people want to lipo their arms, call it arm liposuction. But most times when we lipo the arm, we also do an arm lift. Also, yes, we also lift the
I was
arm.
just about to ask because when you remove the fat from
Yes, it will be
this
flabby.
part,
It will now
yes,
become flabby. So we need to lift it,
Okay.
so that it will be firm.
Okay.
So depending on the area of the body that you want to lipo, that's how the name goes.
Okay.
Yeah.
So what if I want to liposuction my legs? Like remove fat from my legs?
Yes, that's like we'll lipo. You can do that.
Yeah, whatever you allow you to remove fat from my legs.
Why?
I would actually I would love to ask on something, but that should be after the show. Maybe when we're done with liposuction, I can now dive into that. But
Okay.
Yeah. So I want to ask, do you think it's people with low self-esteem that come ahead to get this procedure, or just about anybody?
No, it's not about low esteem. It's not about people with low esteem. Actually, it's people that are actually conscious about their looks.
Wouldn't you call that low self-esteem?
No, it's not.
If you're
It's
overly
not.
critical about your look.
No, you see, it's not really that they are critical about their look, but they just want to look their best. It's just that, okay, for instance, you take some people, they are conscious about their outfit. You understand? They just want to look their best all the time. So it's not about low esteem actually, it's actually about, I mean, putting your right foot front. So
Yeah,
you want,
just taking that step
yes,
to
yes, so that you always
changing my
be at,
weight and
yeah, exactly,
all of that.
Okay.
yeah.
So how do you manage your clients, especially after you've done the procedure? Are there any steps? I don't know
Yeah,
what
sure.
you guys do, aftercare, post-op care, you
Yeah.
guys call it, that you do
Yeah.
for your clients, and what are they?
Okay. Actually, there's usually a follow-up. There's usually a follow-up. And most liposuction, the moment we are done with the liposuction, maybe the patient will just rest for 30 minutes, 1 hour, and then leave.
Like
Yeah.
leave
Yes.
on their feet,
Yes,
like
sure.
leave.
Yes, when it just
After what? Are you
yeah,
serious?
I'm serious. Yeah,
Wow.
I'm serious.
Like,
Liposuction
why are you
is
sure?
just
I'm sure.
liposuction is just a day procedure. We don't actually admit patients for
Are you serious?
liposuction. I'm talking about just the liposuction.
Yeah.
Okay,
just for
That is different
liposuction.
from maybe when we do a liposuction and we are doing a tummy tuck.
tummy tuck, okay.
That is a different thing altogether. But just plain liposuction, we don't admit patients for that.
Liposuction and fat transfer.
Yes, even
You don't admit.
liposuction and fat transfer, we don't admit patients for that.
So I can actually just
You can
stroll
actually
out from
walk
the
in,
office,
yes, walk
have
in
my
and have your
procedure
procedure
done,
and
and go
return
back.
back to the office.
Are you serious?
Yes, I'm serious.
Oh wow.
But do that
serious.
for some time,
Yes.
you'll be feeling numbness.
Even the numbness is not something that's going to incapacitate you, right? It's not going to incapacitate. Just
And I will not be leaking anybody
no,
fluid or any of those things.
because we're actually going to we'll put some things there to absorb whatever is coming out. Some
Oh.
little fluid will still come out.
Okay.
But you can actually walk in, have your surgery done, and actually go back to your house.
Well, of course, there are checkup that I need
Yes,
to
definitely we do follow up. You understand? Because usually when they go like that, we ask them to come back the following day. So that we can remove the dressing, we change the dressing, we ask how they are doing. Sometimes the numbness will usually take care of the pain, but some people, because of their low pain tolerance and all that, threshold, when they come again, we need to give them maybe something to take care of the pain. And then most of our patients are usually on antibiotics. And usually we start them on intravenous or intramuscular. So they usually come back for us to give them the injection, maybe for the next 5 days or thereabout.
Oh, doctor,
So
I'm
there's
really
always
surprised.
a follow-up that.
I'm really surprised because I see on Instagram,
Yeah.
on TV, where
Yeah.
you see people who they just come under the knife and
Yeah.
you see them all in pain.
Okay.
It's always, they make it look very scary.
Yeah, that's right.
They make it look very scary. Like I can't sit. Oh, my body hurts.
Yeah.
This, that. To hear him say that, you can actually
Yes, you
literally
can
just
walk
stroll
in, do your lipo,
back
and
to
actually
your
yes.
normal
Yes.
daily routine. It's
Yes.
surprising.
I've never
to me.
admitted any patient for lipo.
I would say
Surprising.
this is actually a digital age right now.
It's really
Yeah.
surprising. So, Doc, one final question.
Okay.
Do men actually do liposuction?
Yeah, they
I
do.
mean,
Yeah,
can't
they
just be
do.
women that are conscious of their look. I'm sure men
I won't
do.
agree to
So,
this. Why are you now hitting us?
enlighten
Why
us.
are you now hitting
I am
us?
sure
Why
men-
are you
Oh,
hitting
take
us
it
and
easy,
men?
take it easy. At least we've been talking about women.
Exactly.
since, So
It's only
at
fair.
least that is fair. Yeah, that's fair.
Okay,
Yeah, men
I
do
would like to be
liposuction
educated
too.
on that.
Yeah, men do liposuction too.
Wow.
Oh, what body
Well, let me
part?
tell you one secret. Some of the 6 packs you see, some of the 9 packs you see, we actually create them.
Oh, wow.
Yes. And women don't really do 9 packs, 6 packs, and all that. It's men that does that. So I don't know if he has actually benefited from that.
No. I'm a straight up. I'm a straight up.
He's a gym rat. So don't worry.
And also don't forget that some men also actually has this very big tummy.
Yeah.
So they come around to we lipo it for them.
So it's just in that part of their body.
Yes,
stomach
yes,
mostly.
some of them too. They are tie, we
Oh,
lipo their
really?
tie. Yes,
So when
Yeah.
you lipo someone like
big tummy. Yes. Mhm.
Yeah, you do what's it called, skin lifting.
Yes, we actually sometimes depending on the level, we can do like just abdominal liposuction and do what we call panniculectomy. What we do is we just resect the excess skin and then we hold it back and close it again. That one is called panniculectomy. So we do that a lot for men.
Excess English.
You know.
Yeah, I cannot even
We do that a lot.
keep them in my
Well,
head.
in case you want to,
In case of
Yeah.
what?
maybe after you have eaten plenty,
In case of
Yeah.
pounded
after
yam,
what? Pounded yam. We want to
pounded
pound the yam
and
for me. We want to pound
and
the yam.
you know those Ghanaian food that you
Yes.
like, and then your stomach comes out like
My
Yeah.
stomach will not come out. Don't worry. I'll be hitting the gym every day. I'll be hitting the gym like every day. All right, Doc. About this actually just came to my head about women that have given birth
Yes.
and want to do tummy talk.
Tommy, yes, they want to.
Yeah, for like the excess fats
Yes.
and all of that. When they get, is it advisable for them? Because when they get pregnant again, is it going to affect them or?
Yes, that's a good question. You
Yeah.
know, usually, like what I do is that anytime I have a patient that said, okay, this is what I want to do, you know, I've given birth, my tummy is looking flabby, I don't like the way I look, doctor, what can you do? I'll ask the patient, how many kids do you want to have? Do you already have the number you want? If they say no, I'll tell them, please just be patient. Because if we go ahead and do the procedure for you, of course, when you become pregnant again, it's going to break down.
Oh, really?
Yes, it's definitely going to break down.
Oh, wow.
Yes, because when we do tummy talk, we actually go under the skin, and the aponeurosis that makes your tummy firm, we actually try to placate it. You know, we placate it to make it tight.
Let me just pretend I understand what this placating
Okay,
means.
let me
Yeah,
explain.
Let
Let me explain. For instance, usually maybe like for you, the tough tissue that covers your intestine, you know, that one comes in first before the fat, before the skin. The intestine is at the back there. All right. Now, this tissue is actually what gives you that firm appearance here.
Okay.
Now, when you are pregnant, you see the tissue is overstretched because the baby is getting bigger and bigger and bigger, you know. Then that tissue is overstretched. So when it's overstretched, what used to happen is that it will tear. You know, it will tear. You know. So when that happens, even after delivery, you discover that the tummy will not be able to contract back again. You know.
So you'll be forced to
Yes,
go
it will
under.
now be flabby. You know, so when the patient now come and we examine the patient and we discover that there's a tear there, we'll tell the patient you are not only going to have liposuction, you are actually going to have a tummy tuck. You know, so we'll do the liposuction first, then we'll now do the tummy tuck. You understand? Now that tummy tuck, what we'll do is that we'll go under the skin to have access to that tissue that is torn. So what we do is that, you know, for instance, the tissue is torn and it's like this now. So what we'll do is we'll bring the tissues together again and then reflect this one over the other one. You know, that's what we call plication. So by so doing, we decide to now become tight. And then after we are done with that, because we need to actually hold the tissue together inside. Okay? By the time we are done with that, we'll now come out, pull the skin down because the skin now will now be in excess. You know, so we'll now resect the excess skin and close it. Now, that tissue has very poor blood supply. So it's not going to heal back like normal tissue.
Oh, wow.
Okay? So as long as you don't put an extra pressure on the tissue, it's not going to tear again, to remain like that. You know? But wait, if the woman maybe becomes pregnant again and start putting pressure on it again, it can tear again.
Wow.
So that means after delivery again, you need to come for another one. So that's why usually what I tell them is wait until you are done with your family size. Then you can come so that we do it and it will last you for life.
Wow, that's a very good advice. That's a good advice.
So, how much? I'm not saying you should give us an actual figure.
Yeah, I'm not
but
even
just
going to, I will
a
not even
round
be able to
figure.
give you. I'm not even,
A rough estimate
Yeah.
how much this procedure would cost. I mean, in case one of our viewers
Yeah.
watching us right now want to have this procedure done with you guys, they know how much to budget for it. You know, just an estimate. You know.
Well, the budget is actually customized.
Okay.
You know, because it's based on what we see that determines what we are going to do, and that will determine what you are going to pay.
Okay.
You understand? For instance, maybe let me use you as an example.
Okay.
I don't think you have too much fat in your tummy. So if you come and you say, okay, you want to do lipo.
I don't have. Do you want me to stand up?
Yes.
Stand up, see.
You can see.
Look at
You can see that, you see. So So if she comes and she say, okay, doc, please, I need a lipo. Of course, she's not going to pay as much as somebody that comes and you see the tummy really big. So the cost is actually customized.
Okay.
It's individualized. We do it based on what we see and what it's going to entail and all that. But you see, like in our society, it's expensive
Yes.
because of the economy.
Yes.
You understand? But in the Western world, this is a procedure that people do and they don't even think about the cost at all. They don't think about the cost. As far as they are concerned, it's not expensive because, like in the US, before the summer, a lot of them, you see a lot of people coming for this procedure. They just feel it's extremely necessary and
Of course.
it's cost effective.
What girls summer they call
Yeah,
it.
So, doctor, just one last thing.
Okay.
This is the last.
Oh, okay.
And I would call it the least, but it's
Yeah.
actually. Can you just help us dive a bit into the family advice? Like, we would love you to give our viewers an advice on, because I won't say you should give our viewers an advice on how they're gonna look.
Yeah. Okay.
It's their choice.
Yeah, that's
So
right.
I would just say, please give us an advice to the viewers on family. How do I put it? Family care.
Okay. That's as regards cosmetic surgery, right?
As regards cosmetic surgery. No. Let me just as regard to medical term, like
Okay.
treatments. Let's say the family, based on the normal things right now in the country, malaria, typhoid,
Okay.
and all of that. If you can just give a little advice, because I won't say cosmetic because I cannot tell my viewers how they should look.
Okay.
It's their choice.
Okay.
If they want to look that
Oh,
way.
Okay. No, don't worry. I'll call you. I understand your point. But maybe since this is about cosmetic surgery, I'll first of all start with cosmetic surgery aspect, then I'll go into the family practice. All right. Now let's take it this way. These cosmetic surgery procedures mainly is women that actually need it more, and it's women that come more for it. So, and most times, we also listen to our patients, because when they come, we interact with them, and we try to actually understand the reason why they are here, And most of the women or the ladies that come, see, the issue is almost around the same point. Most of them feel, okay, maybe some will tell us, look, doc, I have this guy, the guy likes me a lot, and all that. But the guy is complaining about this part of my body, he's complaining about this part of my body, Some will come and say, well, you see, I'm the type that I like to go swimming, and I like to wear my bikini, and all that. But, this part of my body is making me uncomfortable, when I do that. Some will come and tell us that, look, my husband used to love me a lot, he used to be fun, he hardly allowed me to sleep before, but now the man seems to be having some affair outside, maybe because he's no longer satisfied with what he's seeing, doc, what can you do for me? This is actually what we encounter all the time, Now, I want to just let everybody know that, you see, we have solution to almost everything, If you have a problem and you seek for help, you can actually get help. But when you keep it to yourself, of course, you may not see the help, right? Now, one of the things actually, I want us to be practical. Men are actually attracted to what they see.
true.
Women is what they hear. You understand? That is actually one of the facts.
Why are you agreeing to this?
Because we had this in one of our episodes. You guys, you have to check it out. Actually, it's true. It's true, guys.
Now, for instance, as a young man, you see a lady, there are certain things you see that will make you want to go for her, right? You understand?
Don't worry.
Now, let me be a little bit practical. For instance, maybe you see the shape. Shape is one of the things that attracts men. Now, when we talk about the shape, actually, we are talking about the chest area of a woman, and we're talking about the waist, all right, and then the legs. You see, most times when the lady is young, she has not given birth, all these structures are in order. But maybe by the time the woman has given birth, she has lactated the baby, and all that. Believe it or not, these structures will definitely, collapse.
Women,
And when
go
this
through a
happens, most men will start losing interest. Will start losing interest. But you see, cosmetic surgery has made it possible for us to restore the woman back to her teenage.
Hallelujah.
You understand? Yes, honestly. You see, even if it's not 100%, but at least we can boast of up to 90%. You get? So basically, what I used to advise people is that, look, anytime you discover that, okay, this is about to happen, you can actually see your cosmetic surgeon. And definitely your cosmetic surgeon will do something about it so that the fire can come back.
Yes, so
Yes,
it's very important.
And even apart from that, there's also an aspect of cosmetic surgery that we do, that has to do with the bed canal.
They call
Yes,
it
the bed
vaginal
canal. Yes,
rejuvenation.
vaginoplasty.
Yeah.
Vaginoplasty.
I know so
That
much.
is extremely, extremely effective.
Oh, really?
Yes, I had a couple that came from all the way from Kaduna, and that was their major problem.
Wow.
Because of this, the guy wanted to go and get married to another lady, and all that. But I can assure you that after the vaginoplasty, we just do the anterior, posterior corporaphy, and everything is settled.
But
So
what's the healing process for the vagina?
it's just about a
Vagina.
week, 2 weeks.
Oh, really?
Yes.
Then you can.
Yes, everything returns back to normal.
Wow.
Everything returns back to normal.
Thank God for
And you can
cosmetic
make
surgery.
it even as tight as possible.
Thank
So,
God for cosmetic
All right.
surgery.
Then talking about family practice, we all understand that the economy is biting hard right now. But health is also very important.
Yes.
You understand? So, like the area of family practice is actually where we display our humanitarian project. You understand? Because this comes as an emergency, unlike cosmetic surgery that is not emergency. For cosmetic surgery, the patient will sit down and plan and arrange before they come. But in family practice, boom, they just come, unexpectedly. So in that area, what we do is that instead of keeping yourself at home and say, okay, let me use this, let me use this, until the thing become complicated before you start coming to the hospital. At the end of the day, they end up spending more when they waste too much time at home before coming, especially for children.
Wow.
Adults can actually, endure,
Yeah.
but children can't, and children will not even explain to you how they're actually feeling.
Exactly.
You understand? They may be feeling really bad, but they'll be playing because their friends or their siblings
Of
are playing, so
course.
they'll just join them. Before you know what is happening, boom, they are down. So my advice to us all is that as soon as you notice that, okay, look, you are not well, or your children are not well, your wife is not well, just call your doctor. I think that's all I can
You
say.
heard it from our doc with the most. Call your doctor.
So you've heard it, not all, but you've heard it from our doctor, Dr. Solomon. And please, we would love to know your reviews, your likes, comments, and also we would like you to keep following us. We still thank you guys for the comments, subscription, and contributions you make to our page. And please, as I always say, subscribe.
Subscribe, guys. Subscribe.
Hit that bell.
Very
Click
important.
it. Click the notification button. You can follow us on YouTube at Beyond Board Podcasts, on all our social media platforms: Facebook, Instagram, Twitter, TikTok, name it, at Beyond Board Podcast. And also, you can send your contributions in case you have questions you would love our doctor to pick up for you. And also, if you would want us to handle a topic for you, you can send your questions and topics to our website at www.beyondboardpodcast.com. Until next time, I am David Richard, the guy with two names, and in the house we still have Miss.
Oh yeah, Dave, you know what it is, your girl.
And also all the way from Kubwa, Abuja, Nigeria, Pure Hospital Family Health Center. We still have Dr.
That's all.
Will we see you next time?
See you guys
on
next
Beyond
time.
Board.
Be on board, you guys. Subscribe. Ciao.
Oh.